Hi Mackenzie, my name is Jessica. I'm a student physical therapist. I'm going to be working with you today. So I'd like to do a quick check of your muscle function if that's okay with you. So I'm going to start on your right side here. Get your leg uncovered. Okay. So what I'm going to have you do is go ahead and try kicking that leg up to the ceiling for me, okay? So just extend that leg. Good, and then back down. Any pain with that?
No.
Good job. Okay, so we know she's able to lift against gravity, so we know she's at least at 3 out of 5. All right, this time I'm gonna have you do the same thing, but I'm gonna try pushing you down, okay? And let's see if you can hold against the resistance, okay? Go ahead and try again. Okay, hold here, hold, 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 good. So she was able to go through full gravity, but she wasn't able to hold against more than moderate resistance, so I would put that at a 4 out of 5. If she was a 5 out of 5, it would look like this. Go ahead, try again for me. Hold here, hold, 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 good. So a 5 out of 5 would be full range of motion plus hold against max resistance, okay? All right, so now we're gonna switch to the other side. You all right? Okay. All right. Okay, so this time what I want you to do, so same thing, and I want you to try and straighten that leg for me, okay? Good, and back down, good. Okay, so for this one, she's not able to lift that leg against gravity, so we know that she's less than a 3. So I'm gonna show you how to do a gravity eliminated position. So for this one, we're gonna bring that leg up and then out to the side. Okay, what I want you to try doing, try straightening your leg for me. Good job, good, and then back in, good. So if she can do that against with gravity, then we know that she's at least at a 2. Okay, go ahead and try again for me. Good, back down. Okay, so that would be a 2. Let's demonstrate a 1. So a little bit of activation. So she's able to get a little bit of movement. I can feel that those muscles want to do a little bit of work there, but she can't quite get the range. And then 0 would of course be no movement at all. Okay, so if you were to demonstrate a 0, it would be nothing. Okay, perfect. Okay, Mackenzie, so I know that you've been experiencing some dizziness and some vertigo symptoms, so we're gonna do a couple of tests today to see if we can figure out what might be going on, okay? If at any point during any of these tests you start to feel any symptoms, just let me know, okay? Are you having any symptoms right now? No. Nausea, dizziness? Okay, good. So first thing I wanna do is I just wanna check your range of motion, okay? So I'm gonna have you go ahead and look up and look down. Good, down, good. Any pain with that? No. Okay, what about ear to shoulder? Good, any pain there? Any symptoms? No. Good. And then over your shoulder and the other way. Good. Anything there? No. Okay. So the first test that we're gonna do is I'm gonna put my hands kind of at the base of your skull and I'm just gonna move your head around in a couple different directions, okay? I want you to keep your eyes open because I'm gonna be looking at where your gaze is and I wanna make sure that you keep your eyes looking at my nose the whole time, okay? Okay, you ready? Yes. All right, let my hands over here. Okay. So just right at my nose, okay? Do okay? Good. Okay. So this is a head impulse test, and so basically what we're looking at is for the brain's ability to keep the vestibular system tracking with the eyes. So with movement, if she turns her head to the right side, her eyes should keep her focus and her gaze on my nose at the same time. An abnormal finding would indicate a peripheral lesion, hypofunction of the vestibular system, and that would look like if she turned her head to the right, her eyes would have a hard time tracking. It would actually be slow to catch up. So that would be an abnormal finding. Okay, so the next test that I'm gonna do is gonna be looking at specifically BPPV, which is a type of vertigo that is induced with certain positional movements, okay? So what I'm gonna have you do, you're gonna go ahead and swing your legs up onto the table for me. Okay. Are you having any symptoms right now? Any dizziness, nausea, anything like that? Okay. So what I'm gonna do is I'm gonna be supporting you the entire time, okay? I'm gonna lay you back, okay, on the count of 3. And then I'm gonna hold you in a certain position for about 30 to 60 seconds, okay? Your symptoms are gonna increase, okay? I'm gonna keep checking in on you the entire time. If you feel like you need to vomit or anything, let me know, okay? But we're gonna try and hold it and see if we can get those symptoms to go away, okay? Do you have any questions before we start? No. Okay, so we're gonna do the left side first. So here's what I'm gonna do. Very good spot. Okay, so I'm gonna turn you. Okay, and again, I'm gonna guide you down, okay? So I'm always gonna have a hand on you, okay? All right, so on the count of 3, you're gonna lay on back, all right? Okay, 1, 2, 3. Good job, and I want you to keep your eyes open and look at my nose, okay? On a scale of 0 to 10, what are your symptoms?
0.
0, okay. Okay, great. So what I'm looking for right now is I'm making sure that your eyes aren't doing any sort of movements, which are called nystagmus. That's when your eyes are gonna be moving all around, okay? And everything looks good here. Good. So we would hold this for about 30 to 60 seconds for the purpose of this testing. We're gonna be done on this side. Okay, good job. All right, I'm gonna have you go ahead and sit on up. Good job. Any symptoms when you sit up?
No.
Okay, very nice. Rings caught in your hair. Okay, I'm gonna have you sit there for just a second and then we're gonna do the right side. Okay? All right. So now we've waited a few seconds, so now we're gonna do the right side. Okay, so same thing, I'm gonna turn you to the right. Okay, all right, and then on the count of 3, we're gonna lay you back, okay? 1, 2, and 3. Good job. Okay, keep your eyes open. Look at my nose. On a scale of 0 to 10, how are your symptoms?
I feel like a 6.
A 6? Okay,
Yeah.
so worse on this side.
Yeah.
Okay, so we're gonna hang out here for about 30 to 60 seconds, see if we can get things to get a little bit better. Okay. Good job. Keep your eyes open. Good. So on this side, I am seeing some nystagmus, and it is in an upbeating type of motion. Okay, so we're gonna pretend that 60 seconds has gone away. What's your 0 to 10? What are your symptoms?
Starting to get a little bit better once we hung out here for a little bit.
Okay, good. All right, I'm gonna have you go ahead and sit on up. Okay. So let's sit there for a second. Okay, good. Any symptoms?
No, they're getting better.
Good. Okay, great. All right, so her symptoms were worse on the right side. Okay, so we know that the right side is more affected. She had upbeating, so we know that it's also posterior. Okay, and then because the symptoms did not fatigue, they lasted a very long time. They started to go down after about that 60-second mark, but they were quick and immediate onset, so we know that it's going to be a right posterior cupulolithiasis.